All right, so we're going to go ahead and move on to our O, which stands for objective. Now, with our objective, this is our opportunity to relate the things that we saw, the things that we found, the things that we experienced while we were on the call. You will see that in the first two lines of this particular narrative and most of my narratives, I like to use that space, that time to give my objective section a really, really nice sort of snapshot of the scene and how it looked and how my patient looked when I first arrived. Remember when I mentioned earlier that the the report that you write could be brought back into a legal issue months, even years down the road. So the more of a description that you can give to help sort of recharge your memory banks to bring you back to that time, then the better it's going to be for you if that situation happens. So again, I like to use that first line or two to give a really nice sort of a Polaroid of what I saw when I first arrived on scene, what I saw when I first made patient contact. All right. So O for our objective, engine one on scene at gas station, found 66-year-old male sitting in vehicle alone. Patient's awake, alert, and oriented times 4. No trauma noted. Patient's skin very diaphoretic. Now I'm going to stop right here for just a second. Does everybody have sort of an idea of an elderly gentleman sitting in his vehicle all by himself in front of a gas station who is very sweaty and not bleeding? That's what I was going for. It's going to remind me, it's going to tell the reader what I saw. It's really, really clear as to sort of what the scene and what the patient looked like. All right, we're going to pick back up here. Again, I use a lot of abbreviations as I'm going through my head-to-toe exam. Again, your opportunity to state what you saw during your assessment. Okay, so again, right here. All right. Head, ears, eyes, nose, throat within normal limits and clear. Pupils are equal and reactive to light. No drainage from ears, mouth, or nose. No jugular vein distension. No tracheal deviation. Chest equal rise fall symmetrical. Lung sounds are clear and equal bilaterally. Abdomen soft, non-tender. Pelvis stable. Upper and lower extremities within normal limits. Positive circulation, sensory motor times 4. Back is clear. Now, I spoke a lot. I said a lot of words. All of that I was able to get into 2.5 lines of my narrative just because I'm so comfortable with the use of abbreviations. I've been doing this a long time. I know which ones work. I know which ones are approved. I'm not afraid to write an abbreviation, as you can see. Now, I know some of this doesn't mean anything to you just yet. You're still sort of learning the lingo. You're still kind of learning the verbiage. That's okay. For now, as you're writing these narratives, as you're practicing these narratives, you might want to write it out all longhand. All right. And it's just as easy as you saying, okay, I'm looking at the patient, I'm doing a head to toe. This is what I see. All right. This is what I see. Also, here you're going to state whether or not you actually performed a physical assessment. Let's just say, let me get my hand out of the way here. Let's just say right here, I have lung sounds clear and equal bilaterally. Let's just say that I never did listen to lung sounds. I would make sure that I omitted that section from my reports. You don't ever want to say you did something when you didn't do it, and vice versa. Very, very easy way to get fired. Lying on these documents, it is really, really bad. We can retrain somebody who has, a weakness in a certain skill set, but it's really, really hard to train somebody who habitually falsifies documentation. So again, if you didn't do it, don't put it in your report. And if you did do a task or if you did do a certain sort of examination, what did you see? What did it look like? And what did you do with that particular instance? All right, so please, no falsification of these reports. All right, so there is our objective. We're going to move on down to A. A stands for assessment. Really, really, really quick, 1, 2, maybe 3 words. What's wrong with your patient? A nice little chief complaint. All right. Now you can see here that my patient told me up here that he relates feeling weak while he was driving. So his chief complaint was weakness. Now, remember, I've already finished this call when I'm back writing my report. So I knew that my patient became hypoglycemic. So I knew that he was weak due to the fact that he was hypoglycemic. Again, my hand is in the way. I'm very sorry. So my assessment just says a chief complaint. And if I know what's causing that chief complaint, I'll go ahead and put a reason behind it. Another situation might be maybe you have a patient who is complaining of shortness of breath, and during your time with them, you came to the conclusion that they were having an asthma attack. So you might go ahead and put respiratory/asthma. So that is what our assessment is for. Just really, 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 really quick. Moving on down to P. P stands for plan. All right. This is your opportunity to say, okay, I'm going to let the reader know, I'm going to document in my narrative right now everything that I did for the patient and what I ended up doing with the patient when my call was concluded. All right. So again, starting here, vitals taken, blood glucose equals 49. Patient was assisted with 12.5 milligrams of oral glucose without incident. BGL was reassessed and now is 215. All right, so here I am. I said I did some vitals. I assisted him with some oral glucose because I realized that it was low. 49 is low. And then I went ahead and noted this little part right here, without incident. That just means that I performed a task, I performed a skill, and nothing bad happened in lieu of my action here. All right. So he took the oral glucose. There was no issue. And because of that, we reassessed him later and found out that his blood sugar went up to 215. Now, because my patient was no longer hypoglycemic, his skin condition improved, as well as the patient relating that he is now feeling better. Attaboy, hey, we did it. We figured out the problem. We fixed it. Let's go ahead and document now how our patient is doing after our treatments. Okay. Patient was then assisted out of the vehicle onto the stretcher. Patient was turned over to BCFR Rescue 88 for transport to Palm Bay Community Hospital. Now, since I was in an engine company on this particular call, I ended this call by giving my patient over to another agency. If you are the agency that is responsible for taking your patient to the hospital, you might start here with saying patient assisted out of vehicle on the stretcher, began transport. Maybe you went ahead and put your patient on oxygen. So you would put in there 4 liters of oxygen via nasal cannula, continue to reassess vitals. Once at Palm Bay Community Hospital, patient was transferred over to, sorry, I used HRMC in this one. Whichever hospital you go to, patient transferred to HRMC without incident, patient report given to ER staff. All right. So just as important as it is for you to relate what you did for your patient, we also want to make sure that we relate what we did with our patient. What, did the call just end and then nothing else happened? We have to give it an ending. Okay, guys, I hope this was helpful. I really appreciate you sort of taking the time to listen to this. It's not the most fun subject that we're going to talk about during EMT school, but it is super important that we get a really good, comfortable understanding of how we're going to do reports and how we're going to document. Your FISDAP is going to be there to sort of help you guys through the report writing process. Things like we're going to go ahead and capture sets of vitals. We're going to go ahead and capture what the patient's medical history might be or what their allergies might be. But what we're talking about here is specifically designed for how we are going to construct and write our narratives. All right. So we want to make sure that we get comfortable with doing this. They're not going to be perfect for a while, and that's okay. We completely understand it. But take the time to understand the components so you can really, really start off on the right foot when you guys have to write these narratives on your own. So if you got any questions or issue, go ahead and leave me a comment. I'll get back to you. Hope to see you guys in the lab.